afterwards. Governor, thank you so much. I laid out for people that you're dealing with a quick and severe hit down there. Hospitalizations, 2,000 taking up the beds right now. What is the urgency from your perspective, Governor?
Well, first of all, thank you very much, Chris. The urgency is that we have the highest case growth rate in the country, and the second place state is quite a ways behind us. That's not a distinction that we're proud of. And the percent positivity is above 13% of all tests coming back positive, and that seems to be increasing, which means we have not reached the peak, and we don't know how much further this is going to go. You alluded in your opening that today we reported 11,000 cases. Now that's Saturday, Sunday, and Monday. Almost 2,100 of those cases were kids under 17.
Wow.
Our hospitalizations today are right at 2,000, and tomorrow they will be right at 2,100, the most we've had in the hospital at any point in the pandemic. And yes, this is largely, but not exclusively, a surge among the unvaccinated. About 90% of the people in the hospital with COVID today in Louisiana are unvaccinated. And so we've got a lot of work to do. We've got to get more people vaccinated. There is good news on that front. We've actually had about a 5-fold increase over the last couple of weeks in the number of shots being administered every day. Of course, we have a long way to go because only 38% of the state of Louisiana has actually been fully vaccinated. So there's a tremendous sense of urgency, which is why we're trying to slow the transmission so that we don't lose our capacity to deliver life-saving health care, and not just to the COVID patients. It doesn't matter why you need a hospital. It could be a stroke or a motor vehicle accident. It could be a heart attack. It could be COVID. We reinstituted today the mask mandate when you are indoors in public spaces, whether you are vaccinated or unvaccinated. That was the CDC recommendation, fully supported by the guidance that came out Friday. You were just alluding to it, that while vaccinations do protect against severe disease and death, people are becoming infected and they're infectious. And so we put the mask mandate back in place. We're very hopeful that that's going to give us some breathing room to get this pandemic back under control.
If people follow it, Governor, right? I mean, that's your problem that you've had with vaccinations. You've been putting out the message. They just haven't been following. You said 38% vaccination rate puts you 45th in the United States. You do have 43% with at least one shot. The good news is, over the past week, your state is #1 in new vaccinations per capita. So hopefully, you got a 14% jump from the lottery. The vaccine rate is now double what it was 2 weeks ago, which shows fear may be better, than even a wish and a dream on improving your finances. But you said something that I haven't heard before. You believe 10% of the hospitalizations are breakthrough cases?
Yeah, well, no, in Louisiana, 90% of the people in the hospital with COVID are unvaccinated.
So that means 10% are vaccinated.
Yeah, that's right.
That's high.
And it is high. But I will tell you, a lot of that, I believe, has to do with the prevalence of comorbid health conditions here in Louisiana that may be a little more pronounced than elsewhere. But it is true, though, that if you are fully vaccinated, you're 8 times less likely to get COVID. You're 25 times less likely to end up in the hospital or dead from COVID. So the vaccinations work, and a lot of people are confusing the fact that we are having breakthrough cases with whether the vaccines were efficacious. If you will remember, back when Moderna and Pfizer and so forth came out with the vaccines and they were talking about efficacy, it was protecting people against severe disease, hospitalizations, and death. And that's still the case.
True.
But it never said that it would keep you from getting infected or becoming infectious. And the Delta variant has been a game changer in that respect.
Just in terms of how hard you're being hit on the infrastructure side in terms of your healthcare capacity, one, you got to deal with your healthcare workers getting vaccinated also. We've learned something here. Just because you work in the hospital doesn't mean you're not susceptible to mis or disinformation or being vaccine hesitant. And that's a problem for you also. You have a 33-member federal disaster medical assistance team on site to help Our Lady of the Lake in Baton Rouge Hospital. And how bad are you, well, not how bad, but how worried are you about capacity considerations in the hospitals?
Well, we're extremely worried. And it's not so much a bed capacity. And we have PPE and we have ventilators, unlike a year and a half ago. What we don't have is enough staff. We're short nurses in Louisiana, period, for example. And right now, we have nurses that are out because they too have contracted COVID, and other staff members out, maybe respiratory therapists and so forth. And this really is causing a tremendous problem across our state. We do welcome the help of Health and Human Services. They're on the ground in Louisiana. We're looking to execute on contracts that we have with vendors around the country for staffing. But this is a problem across the country. And when the whole country is surging at once, it's very hard to access new staff to come to our state here in Louisiana. But we're working this just as quickly as we can, and we believe we're going to be able to provide some help. Chris, I want you to know how acute the problem is. Last week, I had a conference call, a Zoom call, with all of the medical directors of the largest hospitals in every region of our state. And following that call, we had 40-something hospitals that made requests to us for additional staffing. At most, we're going to be able to help 5 or 6 of those, and we're trying to triage that, to use a medical term of art.
Governor John Bel Edwards, as you said, you're still at about 13% positivity. These variant curves, they see us somewhere between 4 and 6 to 8 weeks. You're a couple of weeks in now and seeing this ramp up of numbers, so you're only halfway through the forest, maybe at this point. We will stay on it. We're always a platform to put information out, and you let us know what you need. God bless you down there.
Thank you, Chris. Appreciate it.
All right, be well.